If you are over 70 and someone just told you that getting your blood pressure down to 120/80 is a great achievement, you need to stop and hear this. A major study tracked over 15,000 seniors for 5 years, and what they found goes against nearly everything we have been told about blood pressure targets. The seniors who hit that so-called perfect number actually had a 28% higher risk of serious falls, and their survival rates were worse than people with moderately higher readings. Stay with me for the next few minutes, because what you are about to learn could change how you think about your health for the rest of your life. If this kind of real, research-based health information is something you want more of, hit that subscribe button right now. It takes 1 second, and it means you will never miss something that could genuinely matter to your well-being. Here is what is happening in medical offices every single day. A 78-year-old comes in for a routine checkup. Blood pressure reads 145/86. The standard guidelines get pulled up, the target says below 130 systolic, and a prescription gets written. A few months later, blood pressure is down to 124/78. Everyone is pleased. It looks like a success story on paper. But here is what the chart does not show. That same person now gets up in the middle of the night to go to the bathroom, and their blood pressure crashes from 124/78 down to 88/56 within seconds. Their brain is not getting enough blood. The room spins. They reach for the wall and miss. Suddenly, we are not talking about blood pressure numbers anymore. We are talking about a fractured hip, emergency surgery, weeks in rehabilitation, and a cascade of complications that too often ends in permanent loss of independence. This research was published in a leading medical journal and should have made headlines everywhere. Most patients have never heard about it. That gap between what the research actually shows and what is happening in everyday medical practice is costing people their quality of life. Here is the part that will sound counterintuitive, and you need to stay with me because this is where everything changes. For decades, the message has been simple: lower blood pressure equals better health. For people in their 40s and 50s, that is largely true. Bringing blood pressure under control in middle age protects against heart attacks, strokes, and kidney damage. The evidence there is solid. But something fundamental changes after age 75, and the research is now showing it clearly. Seniors with systolic blood pressure between 130 and 145 actually live longer than those with pressure below 120. They have fewer falls, fewer fractures, fewer hospitalizations, and sharper cognitive function. The group that achieved that textbook perfect 120/80 had higher rates of dizziness, fainting, kidney injury, and yes, higher death rates. The number that looks best on paper turned out to be the most dangerous for older adults. To understand why, you need to know what aging actually does to your cardiovascular system. Your body at 75 is not just an older version of your body at 45. It is physiologically different in 3 critical ways that completely change what blood pressure numbers mean for your health. First, arterial stiffness. As you age, your arteries lose their elasticity. Think of a brand new garden hose compared to one that has been sitting outside in the sun for 20 years. The old one is rigid, less flexible. Your arteries go through a similar process. When your heart pumps blood into stiff arteries, they cannot expand and absorb the pressure the way younger, more flexible arteries can. This means your body actually needs a slightly higher baseline pressure to push blood all the way up to your brain and kidneys, especially when you are standing upright and working against gravity. Second, your pressure sensing system slows down. Your blood vessels contain tiny sensors that detect pressure changes and instantly signal your brain to compensate. When a young person stands up, those sensors respond within milliseconds. Heart rate increases, vessels constrict, pressure stabilizes. In older adults, these sensors become sluggish. They respond more slowly. So if your baseline blood pressure is already low and your sensors are slow, you get that dangerous pressure crash when you stand up. It has a clinical name: orthostatic hypotension, and it is one of the leading causes of falls in older adults. Third, your body processes medication differently. Your kidneys and liver do not clear drugs as efficiently at 75 as they did at 45. A dose that is perfectly appropriate for a middle-aged person can be far too strong for an older adult. The medication stays in your system longer, has a stronger effect, and can push blood pressure dangerously low at the wrong moment. Drop a comment below right now with just your age. Nothing else, just your age. I want to see who is watching, because the information I am sharing applies differently depending on whether you are 65, 75, or 85. And if you have ever felt dizzy when standing up from a chair or getting out of bed, add the word dizzy to your comment. That detail is important, and you will understand why in just a moment. Now let me give you the specific numbers from the research, because the details matter here. The study followed over 15,000 adults aged 75 and older for an average of 5 years. These were real-world older adults, not carefully selected healthy volunteers. The group included people with diabetes, prior strokes, heart disease, and varying levels of frailty. The results were striking. The lowest mortality rate was in the group with systolic pressure between 130 and 140, not below 120. The moderate range. Those with pressure below 120 had a 28% increased risk of serious falls requiring hospitalization, higher rates of acute kidney injury, and an overall mortality rate 14% higher than the 130 to 140 group. The group with pressure above 150 also had problems, as expected, with more strokes and cardiovascular events. But the finding that shocked researchers was that very low pressure was just as dangerous as very high pressure. The sweet spot for survival was higher than what standard guidelines recommend. Here is a real scenario that plays out thousands of times a day. A 76-year-old goes to a routine appointment. Blood pressure is 142/84. Treatment is started. A few months later, it is 128/78. A second medication gets added. 2 months after that, it is 122/76. Perfect, everyone says. But now this person notices something. When they stand up to answer the phone, there is a split second of lightheadedness. When they get up from the dinner table, the room tilts for a moment. Their doctor says it is probably just age-related, blood vessels adjusting more slowly, just stand up gradually. What is actually happening is that the blood pressure, which looks fine sitting still in an office, is dropping from 122/76 down to 95/60 when they stand up. Their brain is experiencing repeated episodes of inadequate blood flow. Every time they stand, they are one misstep away from a fall. But nobody is checking for this because the sitting number looks perfect. There is a simple 3-minute test you can do at home tonight to find out if this is happening to you. All you need is a home blood pressure monitor, available at any pharmacy for around $30. Here is exactly what you do. Lie down flat on your bed or couch and rest for 5 full minutes. After 5 minutes, check your blood pressure while still lying down and write down both numbers. Then stand up and immediately check your blood pressure again while standing. Do not wait. Take the reading right away. Write those numbers down too. Now compare the two readings. If your systolic pressure dropped by more than 20 points, or your diastolic dropped by more than 10 points when you stood up, you have orthostatic hypotension. That is a red flag. It means your blood pressure may be too low for your physiology, or your medications may be stronger than what your body can safely handle. To make it concrete, imagine your lying pressure is 125/78. Looks great. But when you stand, it drops to 98/64. That is a 27-point systolic drop. Your brain is operating on insufficient blood flow every time you are upright. You might feel fine on the couch, but standing and walking around, you are at elevated risk. This is the test that should be done at every medical visit for anyone over 70 on blood pressure medications. If it is not being done, you can do it yourself and bring the results to your next appointment. If this video is giving you useful information, please take a second to like it right now. It helps more people find content like this. And honestly, it might help someone you know stay safe. Share it with a family member or friend who is over 65. So, what should your blood pressure actually be? Here are the ranges that current research associates with the best outcomes by age group. Keep in mind, these are general guidelines, not absolute rules. Your individual target depends on your full health picture. For adults between 65 and 74 who are generally healthy and active, research supports a systolic range of 130 to 140. This provides cardiovascular protection while keeping blood flow adequate to vital organs. For adults between 75 and 84 who are relatively healthy, the evidence supports a systolic range of 135 to 145. This is intentionally higher than the younger group because it accounts for arterial stiffness and slower pressure-sensing responses. For adults over 85, or those who are frail regardless of age, a systolic range of 140 to 150 may actually be the most appropriate target. At this stage, preventing falls and preserving quality of life often matters more than aggressive pressure reduction. On the diastolic side, that bottom number should generally stay above 65 and ideally between 70 and 85. Very low diastolic pressure reduces blood flow to the heart muscle during the relaxation phase and can create serious problems. If your diastolic is consistently below 60, that is worth a conversation with your care provider, even if your top number looks fine. Now consider two people who are both 81 years old. Both have blood pressure reading 158/88. Same age, same number, but completely different situations. The first person has mild heart failure, chronic kidney disease, and arthritis. Pushing their blood pressure aggressively below 130 with multiple medications carries real risks. Those drugs could cause dangerous pressure drops when standing. They could worsen kidney function. And with arthritis already limiting mobility, a fall could be catastrophic. A more thoughtful approach would be lifestyle changes first, then possibly a low dose of a single medication, targeting around 140 to 145 systolic, rather than pushing hard for 130. The second person is active, plays golf twice a week, no significant medical history. For them, 158/88 might warrant lifestyle changes and monitoring, but potentially no medications at all, accepting that 145/84 is a perfectly reasonable and safe target. Same numbers. Two completely different approaches. That is what it means to treat the person, not the reading. Here is why your care provider may not have mentioned any of this. Most standard blood pressure guidelines were developed from large clinical trials conducted primarily in middle-aged adults. When those results came in, the targets were applied broadly across all age groups, assuming what protects a 50-year-old must also protect an 80-year-old. It took years of follow-up research on older populations specifically to reveal that this assumption was wrong. And even when new research does emerge, it can take a decade or more to filter into clinical guidelines, and even longer to change everyday practice. Many providers are still following frameworks established years ago. There is also an ingrained psychological factor. The message that lower blood pressure saves lives has been repeated for so long that shifting toward a more nuanced view requires a genuine rethinking of deeply held assumptions. In a system where appointments are short and time is limited, individualized decision-making is genuinely difficult. That is why the most powerful thing you can do is walk into that appointment informed. Here are the concrete steps to take starting today. First, if you are over 70 and on blood pressure medication, get a home monitor if you do not have one. Check your pressure at the same time every day, morning and evening, for 2 weeks. Keep a written log. This gives you a far more accurate picture of your true average than occasional office readings. Second, do the orthostatic test described earlier. Lying down for 5 minutes, take a reading, Then stand and take another immediately. If you find a drop of more than 20 systolic or 10 diastolic, document it and bring it to your next appointment. Third, honestly assess how you feel day to day. Are you dizzy when standing? Unusually fatigued? Having trouble concentrating? These may be signs that your pressure is running too low, even if the numbers on paper look good. Fourth, have a direct conversation about your targets. Do not simply accept a generic goal of 120/80 without asking whether that is actually appropriate for your age, your conditions, and your daily activity level. Bring your home readings. Bring your orthostatic results. Ask specifically what range is right for you as an individual. Fifth, if you are experiencing side effects from your medications, speak up clearly. Dizziness, fatigue, and brain fog are not things you simply have to endure. Doses can be adjusted, medications can be changed, targets can be modified to improve how you feel day to day while still protecting your heart. Here is what you now know that most people do not. Blood pressure targets are not one size fits all. A 45-year-old and an 85-year-old should not be held to the same standard. For older adults, especially those over 75, a systolic reading between 130 and 145 is associated with the longest survival and the best quality of life. Below 120 increases risk of falls, fainting, kidney injury, and possibly cognitive decline. Above 150 increases cardiovascular risk. The optimal range sits in the middle, and it is higher than what most people have been told to aim for. You also now know how to test yourself at home for the condition that causes most of these problems, and you have a clear framework for talking to your care provider about targets that actually fit your age and health profile. That knowledge is not small. It is the difference between being a passive recipient of medical decisions and being an active, informed participant in your own care. If this helped you today, please leave a comment below saying informed. It tells me this content is reaching the right people, and it genuinely helps others find it too. And if you are not subscribed yet, do it now. New videos go up regularly covering real research on real health topics that matter to people over 60. You do not want to miss what is coming next, because the next video covers 3 supplements that research shows can actually support healthy blood pressure naturally, and 2 popular ones that are a complete waste of money. The supplement industry is full of misleading claims, and I am going to show you exactly what the evidence says. See you there.